Welcome back, viewers. You're watching The Savera and I'm Vidhi Joshi. Breast cancer continues to be a major cause of illness and death among the women, especially in rural areas, where lack of awareness, limited access to healthcare and late diagnosis contribute to poor outcomes. What is breast cancer? Breast cancer is a type of cancer that forms in the cells of the breast, most commonly in women, but can also occur in men. It typically begins in the milk-producing ducts or glandular tissue. Early signs to detect breast cancer. Early signs may include a lump in the breast, changes in breast shape, dimpling of the skin, or nipple discharge. Risk factors include age, genetics, family history, and lifestyle choices. Diagnosis involves physical exams, mammograms, and biopsies. Treatment options vary based on the stage and may include surgery, radiation, chemotherapy, hormone therapy, or targeted therapy. Early detection significantly improves the chances of successful treatment. Recently conducted study on breast cancer in Punjab. A recent study has highlighted the urgent need for improved cancer care infrastructure and early detection programs in these regions. The finding call for a concerted public health response to ensure timely diagnosis and uninterrupted treatment, particularly in resource-limited settings. This study, performed at a community health center in Amritsar, provides insights into the treatment challenges faced by 200 breast cancer patients between 2021 and 2024. The retrospective analysis led by G. Singh from the National Health Mission, Amritsar, focused on patients aged 25 to 72 years who were managed with systematic therapies including chemotherapy, hormonal therapy, and targeted treatments. The findings reflect the critical role of systematic treatment in rural settings while also exposing significant barriers to effective care. Alarmingly, 65% of patients presented with stage 3 or 4 breast cancer, underscoring the prevalence of delayed diagnosis in underserved regions. Chemotherapy was administered to 80% of the patients, while 55% received hormonal therapy based on hormone receptor status. Targeted therapies such as HER2 inhibitors were provided to 30% of eligible patients. Despite the availability of treatment, only 70% of patients adhered to prescribed systematic therapies. Factors such as financial constraints, lack of awareness, and transportation difficulties contributed to non-adherence. However, patients who completed treatment experienced notably better progression, free survival, and quality of life. The study, Systemic Treatments in Breast Cancer, a community-based analysis from rural Punjab, stresses the urgent need for comprehensive community-based interventions. These include early detection initiatives, patient education, financial support schemes, and stronger collaboration between rural health centers and tertiary care institutions. 7% rise in cases in 2024 when compared to 2023, Punjab faces a rising burden of breast cancer. The state has 4 population-based cancer registries located in Sangrur, Mansa, Mohali, and Patiala, collectively covering urban, semi-urban, and rural populations. According to data from these registries, the number of breast cancer cases in Punjab increased from 39,521 in 2021 to 42,288 in 2024, a 7% rise. Breast cancer now accounts for 30% of all cancers among women in the state, with an age-adjusted incidence rate of 37.5%. That is 1 lakh, the highest in the nation. In response to this growing health challenge, the Punjab government launched an innovative early detection program aimed at improving cancer outcomes in the rural areas. The initiative has already demonstrated success in increasing early-stage diagnosis of breast, cervical, and oral cancers. Implemented in Sangrur and surrounding areas within a 50-kilometer radius of the Homi Bhabha Cancer Hospital, a unit of Mumbai's Tata Memorial Center, the program was specifically designed to address the high prevalence of the late-stage cancer diagnosis in low-income communities. Breast cancer in urban India. However, despite better healthcare access, late detection remains another major concern in the fast-paced urban world, driven by several lifestyle factors, stress, late pregnancies, and increased exposure to environmental risk. Increasing cases of breast cancer among celebrities. Several Bollywood and TV actresses have bravely battled breast cancer, inspiring many with their strength. Recently, popular TV actress Hina Khan revealed her breast cancer diagnosis on social media in 2024. She is undergoing chemotherapy. Hina's openness has touched fans and she continues to receive widespread support as she fights this challenging battle. Along with her, several Bollywood actresses had to fight breast cancer at one time. These actresses serve as symbol of hope and resilience to many. Veteran actress Mumtaz was diagnosed in 2002 at the age of 50 and is now living in London after recovery. Mahima Chaudhary fought breast cancer in 2022 and has fully recovered. Thaira Kashyap, wife of actor Ayushmann Khurrana, was diagnosed in 2018 and faced the disease with courage, supported by her husband. Actress Chavi Mittal also overcame breast cancer in 2022. South Indian actress Hamsa Nandani battled the disease in 2021 and returned to work after treatment. Meanwhile, by making several lifestyle changes, one can reduce the risk of breast cancer at their own. Essential steps required is maintaining a healthy weight, exercising regularly at least 150 minutes per week, eating a balanced diet rich in fruits, vegetables and whole grains, limiting alcohol consumption, avoiding smoking, breastfeeding if possible, limiting hormone replacement therapy, getting regular breast screenings and self-exams, knowing family history and consulting a doctor about genetic testing if needed, managing stress and ensure adequate sleep. Adopting all these lifestyle habits can significantly lower the risk of developing breast cancer. That's all for now. Stay tuned to the Savera for more updates. Do like, comment and subscribe to the channel.